Assalamu alaikum. Today I am explaining the cortical areas in the cerebral hemisphere. Here, this is the cerebral hemisphere. The cortical area is explained into the different areas described by the Broadman, and the simple division of the cortical areas into the motor or the sensory is erroneous, for many of the sensory areas are far more extensive than originally described. So first of all, here I am explaining the lobes of the cerebral hemisphere. This is the central sulcus, and this central sulcus divides the anteriorly as a frontal lobe, posteriorly as a parietal lobe, and posteriormost is the occipital lobe. Lower lobe is shows as a temporal lobe. So as first of all, our frontal lobe. The precentral area, this is called a precentral area. The precentral area is situated in the precentral gyrus. This is called as a precentral gyrus. This is the central sulcus. This is the precentral gyrus. This is called the precentral gyrus, and includes the anterior wall of the central sulcus. This is the anterior wall of the central sulcus. This is the precentral gyrus, and the posterior part of the superior medial and inferior frontal gyri. So this is the superior, this one is the middle, and this is the inferior frontal gyrus. It extends over the superior medial border of the hemisphere into the paracentral lobule. So it extends inside till the paracentral lobule. Now, the precentral area may be divided into the posterior and anterior region. This is called the precentral area, which is divided into the posterior and anterior region. This is the posterior and this is the anterior region. The posterior region, which is referred to as the motor area, this is called a motor area or a primary motor area or a Broadman area 4, and it occupies the precentral gyrus extending over the superior border into the paracentral lobule. The anterior region, this is the anterior region, and this is called the premotor area, secondary motor area or a Broadman area 6. And a part of the area 8, here suppose there is a part of the area A which is called the frontal eye, and area Broadman area 44 and 45. Here there is a Broadman area 44 and 45 is present. The primary motor area, now first of all we are talking about the primary motor area, which is also called the Broadman area 4. It electrically stimulated produces isolated movements on the opposite side of the body, as well as the contractions of the muscle groups concerned with the performance of a specific movements. The movement areas of the body are represented in the inverted form in the precentral gyrus, starting from below, passing superiorly, and then goes towards the superior part of the paracentral. Now the structures involved in lower side swallowing and the tongue. This is the swallowing tongue, jaw, lips, larynx, larynx, eyelid and brow. The next area is an extensive region, the extensive region for the movement of the fingers, especially for the movements of the fingers, especially the thumb, hand, wrist, elbow, shoulder, and then the trunk. The movement of the hip, knee and ankle are represented in the highest area of the precentral gyrus, and these surfaces are present in the medial surface of the cerebral hemisphere in the paracentral lobule. The movement of the anal and vesical sphincters are also located in the paracentral lobule. So I will show you a diagram where the motor homunculus on the precentral gyrus is shown, as in this diagram. So it's starting from the lateral lower side, inferior side, lateral upper side, superiorly side, and then it goes towards medially side near the paracentral lobule. Here, starting from motor homunculus, starting from here, lateral, inferior, superior, and then medial side. So homunculus diagram shows that it starts from the larynx, pharynx, tongue, jaw, lips, eyes, neck, and then hand, in which the thumb is taking a largest part, then the upper hand, then trunk, and then the medial side of the paracentral lobule can take the medial surface of the movement of the toes are situated on the medial surface of the paracentral lobule along with the vesical sphincters and the anal. The area of the cortex controlling a particular movement is proportional to the skill involved in performing the movement and the mass of the muscle participating in the movement. Now the premotor area. Here in this is called a premotor area, which is wider superiorly than below and narrow down to confine to the anterior part of the precentral gyrus. The premotor area receives numerous input from the sensory cortex, the thalamus and the basal ganglia. The function of the premotor area is to store programs of the motor activity assembled as a result of the past experience. So premotor area taking messages from the as a memory. Thus the premotor area program activity of the primary motor area. So normally it is controlling the coarse postural movement, though its connection with the basal ganglia. In a sagittal view, now I am here shows you a paracentral lobule. This is called a paracentral lobule. And in front of the paracentral lobule, on the medial surface of the hemisphere, this area is called the supplementary motor area. And this is the area result in the movement of the contralateral limbs. Removal of the supplementary motor area produces no permanent loss of the movement. This is called the supplementary motor area, and this is our paracentral lobule. Now frontal eye field. Now the frontal eye field. The frontal eye field extends forward from the facial area of the precentral gyrus into the middle frontal gyrus. This is the middle frontal gyrus. So here the frontal eye field is present, which is the Broadman area 8, and 6 is also present here. So the involuntary following of the moving objects by the eyes involving the visual area of the occipital cortex to which the frontal eye field is connected by the associated fibers. Now the motor speech area. The motor speech area, which is the Broadman area 44 and 45, these are located in the inferior frontal gyrus. This is the inferior frontal gyrus. This is the inferior frontal gyrus, and between the anterior and posterior rami of the lateral fissure. This is the anterior rami, and this is the posterior rami of the lateral fissure. Broadman area 44 and 45 is present here, and these are the Broca's speech area, which brings about the formation of the words by its connection with the adjacent primary motor area. So Broadman, this is called the Broca's speech area, which brings about the formation of the word by its connection with the adjacent primary motor area. The muscles of the larynx, mouth, tongue and soft palate. Here these muscles are present. This is the Broadman area 44 and 45. So the last one is the prefrontal cortex. This is called the prefrontal cortex part. Extensive area that lies anterior to the precentral area. It includes the greater part of the superior, middle and inferior frontal gyri, as we will explain previously that this is the superior, this is the middle, and this one is the inferior frontal gyrus. The orbital gyri and the cingulate gyri is also included in this. This is the cingulate gyrus. The prefrontal area is concerned with the makeup of the individual's personality as the result of the input from many cortical and subcortical sources. This area plays a role as a regulator of the person's depth of feeling. It also exerts its influence in determining the initiative and judgmental of an individual. So in short form, this is the frontal lobe, this is the primary motor area, this is the premotor area. Here the frontal eye field is present, and these are the Broadman area 44 and 45, and this is a supplementary motor area. Thank you.